when we talk about the Admi Party's flagship healthcare initiative, which is the Mohalla clinics. Now, this time around, they seems to be facing serious allegations of financial irregularities and inflated testing figures. Based on a preliminary inquiry by the anti-corruption branch, which were a report that we have accessed, two private diagnostic labs contracted by the Delhi Sarkar are under scrutiny for their alleged involvement in the scheme involving ghost patients and fake tests. Fake lab tests, financial loss, inflated costs, and also phantom patients. The list of the discrepancies only gets longer. Over 72 lakhs lost to the exchequer that has been talked about. Two private diagnostic laboratories where these fake tests may have been conducted. Even when it comes to fake mobile numbers that have been registered against fake patients is something that is also being talked about. The list of discrepancies only gets longer. Over 65,000 tests that have been conducted. We talk about one of those private labs, the Diagnostic and Metropolis Healthcare. These two are said to be suspected to have fabricated involving ghost patients who never visited the clinic. The alleged fake test also resulted in a potential loss of over 72 lakhs to the public exchequer. Let's talk about these two laboratories as well. Even when it comes to the medical institutions individually, this is the Diagnostics Limited from the time period of February 2023 to November 2023. Over 25,000 tests that have been done on mobile numbers of zero. Zero has been the mobile number that has been registered. Let's talk about the Metropolis Healthcare. From February 2023 to December 2023, over 11,000 tests that have been done, and this has been done on mobile numbers which have been repeated over time. One of the other private labs that have been contracted by the Delhi government for Mohalla clinics is now finding itself under intense scrutiny, and this is coming at a time during the ACB inquiry that has been taking place. Also, when it comes to the legitimacy of the tests, over 900 of them that were associated with the phone numbers that seems to start from 1, 2, 3, 4, 5. These were the digits that were repeated, which was highly improbable for a genuine patient record. Over 2,400 tests were linked to mobile numbers that were used over 80 times for different patients. So imagine different patients having the same mobile number, indicating potential data manipulation. There is also a significant mismatch between the registered patients and their mobile numbers used for the test, suggesting that there could be further irregularities. Those are the allegations that have been leveled as far as the preliminary inquiry that is being conducted by the ACB. There is another lab which is under lens, which is the Metropolis Healthcare. And we also talk about this report itself, which in detail we'll talk about as Times Now has accessed this report, because this investigation reveals an alarming patterns in their testing data. Let's also deep dive into the concerns that have been raised. Over 6,000 tests registered on fake mobile numbers that goes on to 9999999 and so on, indicating potential ghost patients who never probably even existed. We have Sabyasachi joining us right now. Quickly going across to Sabyasachi. Sabyasachi, this is big and this is explosive. Mohalla clinics, but now marred with this kind of allegations that have been leveled in this preliminary inquiry conducted by the ACB.
Well, absolutely. See, from the preliminary investigation, such massive details have come out surrounding the Mohalla Clinic, which was the flagship program of the Aam Aadmi Party, is now under the scanner. Now, as far as the preliminary report is concerned, there has been several crores of malpractice which has been done. Now, we had seen that several thousand patients whose were falsely registered, numbers starting with 999, 000, 1, 2, 3, 4, 5. These fake numbers were used, and now the doctors have pre-recorded their videos to mark attendance, and also the medicines which were supplied to the patients who were visiting the Mohalla clinic. These medicines were provided by unauthorized staff. So these are the allegations and findings which has come out in the preliminary report. And as far as the ACB investigation is concerned, see, Mohalla Clinic has been in existence for quite some time, and the two laboratories who were in charge to conduct the test, within few months of investigation, the ACB has found around 65,000 people who have been falsely registered. Now the ACB has called in a few doctors from the Mohalla clinic as well as a patient, but all of them have said that specifically the patients have said that they have never visited or they have never carried out.
But we talk about this report also that has been accessed by Times Now. Please do stay on with us, Sabyasachi. We have Deepak joining us with the report and the details that seems to be damning allegations that have been leveled by the ACB. Yes, Deepak.
Right, Amita, this is the document that Times Now has accessed about the ACB's preliminary report on the Mohalla clinics, the initiative by the Admi party. And the name of the alleged officials involved in this are basically two laboratories or two medical entities. One is the Diagnostic Limited and the other one is Metropolis Healthcare Limited. And in the document, if I could scroll down and tell you what happens in the preliminary report, is that the ACB has found that a large number of tests were recommended for mobile number of 0 digits, blank mobile number, and also fake mobile number starting from 1, 2, 3, 4, 5. And in this context, a detailed analysis chart has also been prepared, Amita, here. The scam, or rather the irregularities, date from February to 2023 to November 2023. And if you could see, these are the columns of different mobile number variants. First column speaks about the test conducted with blank mobile number. In May, they had conducted 2, but a total with using this mobile number, the number of tests that were conducted was 12,457, and the total test conducted with the mobile number 0 is 25,732. Total tests conducted with fake mobile numbers starting with 1, 2, 3, 4, 5 is 913, and at the end of it, the total loss that has been incurred by the exchequer is 72 lakh rupees. This is what the ACB has found. And also, these are the numbers that were repeatedly used for different patients on different occasions between February 2023 and November. For instance, this particular number was used 771 times for 771 individuals, saying that the tests were conducted using this mobile number. And furthermore, Amita, here we have the mobile numbers owners who have said that who have denied to have received any treatment under their mobile number. And we also have many such cases of people who have these mobile numbers, who possess these mobile numbers but haven't taken any tests.
So the tests and the mobile numbers also don't match. Deepak, thank you very much for those details. Coming back to you, Sabyasachi. Sabyasachi, how exactly did this investigation begin? In fact, what was revealed? And especially when it comes to those patients who have never done those tests, raising serious questions about this data manipulation. How did this alleged scam come to light?
Well, absolutely. The health department had carried out an investigation into this matter. If you remember that LG himself was involved in this, the LG has issued a CBI inquiry into this matter, whereas in the investigation of the health department, it was found out that how substandard medicine was being provided at Mohalla clinic and at the Delhi government-run hospital. And also it was found that how these fake lab tests was being carried out, where fake numbers were being registered and to carry out fake lab tests. Now, under this, the ACB has been carrying out this investigation. The ACB has looked into records for past several months, and under these months, these records has come out where around 65,000 people have been registered with fake mobile numbers. Now, during this time, the two labs has been charging the government and causing several crore loss to the exchequers. Now the ACB is just touching the tip of the iceberg, and they have to see other records as well. Meanwhile, we had seen that the ACB physically had called in doctors from the Mohalla clinic as well as doctors who are in the hospital. Now the ACB also highlighted that how doctors were not carrying out the treatment. They had pre-recorded videos to mark their attendance, and people who were going to the Mohalla clinic, they were being
suggesting fabricated records as far as this interim inquiry report by the ACB is concerned, and a significant mismatch that exists between the registered patients and the mobile numbers used for tests, further highlighting certain manipulation when it comes to data and irregularities.